Acne scars could be frustrating, but with the advancement of recent technologies in the aesthetic industry, it can become less and less noticeable. In this video, we will be talking about all kinds of acne scars and its treatment, and if you want to be your own skincare expert, keep watching. Acne scars could either be atrophic scars or hypertrophic scars. Atrophic scars are more common and is around 80% of the total type of acne scars. It is because of collagen loss, and it leads to depletion of collagen and elastin, leading to all kinds of depression onto the skin surface. This includes ice pick scars, which is the commonest type of acne scars and is seen in around 60 to 70% of individuals. These have a narrow opening and a pointed and deep end. It mostly looks like open pores. It is very resistant to treatment and can be treated with something known as TCA cross only. The second most common type is box scar type of scar, which is seen in around 20 to 30% of individuals. These are U-shaped, shallow, with sharp edges. They respond mostly to all kinds of acne scar treatment, be it derma roller, fraction laser, microneedling RF, even PRP. The third type is rolling scars, and it constitutes 15 to 25% of total atrophic scars. This gives an undulating appearance to the skin surface. They respond best to subcision. The results of these acne scars is permanent. It normally takes 4 to 6 sessions once every 2 weeks in order to see the maximum results. But before you start treatment of acne scars, it's very important to treat acne first, because otherwise your skin would continue to cause inflammation and continue to cause more destruction and scarring on the skin surface. The less common variant of acne scar and the lesser known is hypertrophic scars. This is seen only in people who have a tendency to develop these kind of scars. This is an abnormal response to wound healing. This includes keloids, papillary scars, or hypertrophic scars. They can respond to certain steroid injections, silicone dressings, and compression garments, but very resistant to treatment, and recurrence is most often a rule. Medications mostly do not have a role in scar improvement, but oral medications like oral retinoids improve early scars by a process known as scar remodeling. I hope after this video you don't need to hide your scars under makeup. Till the time, be beautiful, be influential.